Blood pooled on the sterile linoleum in a perfect, terrifying circle, expanding faster than a heartbeat. The renowned chief of surgery stood frozen, his trembling hands hovering over a shredded artery he couldn't clamp. The monitor screamed a flatline warning. That's when the quietest nurse in the hospital shoved him aside. In the blindingly bright, endlessly chaotic corridors of Boston's St. Vincent Medical Center, Nurse Claire Dempsey was essentially a ghost. She was a woman who navigated the high-stakes, high-adrenaline environment of the Level 1 Trauma Center with a silent, almost unsettling efficiency. In a profession often fueled by dark humor, whispered gossip at the nurses' station, and vocal complaints about the grueling 12-hour night shifts, Claire was a complete anomaly. She didn't socialize. She didn't complain. With her prematurely graying hair pulled back into a severe no-nonsense bun, and her faded blue scrubs fitting a size too large, she was the kind of person you looked past. To the junior staff, she was simply part of the architecture, reliably present, highly functional, but entirely invisible. Which was exactly how Dr. Aidan Kensington preferred his nursing staff to be. Dr. Kensington was the hospital's undisputed golden boy, a brilliant blue-blooded trauma surgeon who had completed his grueling residency at the top of his class at Johns Hopkins. He possessed a pair of phenomenally steady hands and an ego massive enough to possess its own gravitational pull. Aidan walked through the ER sliding doors as if he owned the building. He wore custom-tailored scrubs that actually fit his athletic frame, and his surgical clogs were always immaculately clean. To Aidan, nurses and junior residents were merely organic extensions of the hospital equipment. They existed solely to hand him scalpels, fetch charts, and strictly follow his orders without hesitation or question. It was a Tuesday evening in late October. The ER was humming with the usual low-level dissonance of minor car accidents, kitchen lacerations, and flu patients. Aidan had just finished a complex but ultimately routine appendectomy on a local politician. He was feeling particularly invincible as he strutted down the hallway, loudly lecturing a terrified first-year resident named Dr. Hayes about the importance of elegant tissue handling. You don't just hack through the fascia, Hayes Aidan patronized, not bothering to lower his voice. Surgery is a symphony. It requires a maestro. Brute force is for butchers and carpenters. Remember that. Aidan pushed open the heavy glass doors of Trauma Bay, to a pristine, sterile room waiting for its next disaster, and abruptly stopped mid-lecture. Claire was standing by the primary crash cart, quietly restocking the top drawer. Her movements were completely mesmerizing if one bothered to watch. She didn't fumble or search. Her hands darted from the supply boxes to the cart in a rhythm of pure practiced muscle memory. Aidan watched her for a moment, his lip curling in sudden disdain. His sharp eyes caught sight of an anomaly in his perfectly ordered domain. Tucked into the top drawer, right alongside the standard hospital-issue rubber bands, pre-cut tape, and blood pressure cuffs, was a thick black windlass-style combat tourniquet. "Nurse!" Aidan snapped his voice, echoing sharply off the cold, tiled walls, cutting off the rhythmic beeping of a distant heart monitor. "What is your name?" Claire paused. She held a fresh box of trauma dressings in her hands. She turned slowly, her posture perfectly straight, her expression entirely unreadable. "Claire Doctor, Claire Dempsey." "Well, Claire Dempsey," Aidan said, stepping closer. He reached into the sterile drawer and plucked the heavy combat tourniquet from the cart. He dangled the thick black nylon strap between two fingers as if he were holding a dead rat by the tail. Care to explain why this piece of theatrical paramilitary garbage is cluttering my pristine crash cart? It is a backup hemorrhage control device, Dr. Kensington, Claire replied, evenly, her voice devoid of defensive inflection. This is a civilized civilian hospital, Nurse Dempsey, not a Sylvester Stallone movie. Aiden scoffed, turning to Dr. Hayes to ensure the resident was appreciating his wit. We use precision instruments here. We use hemostats. We use elegant surgical techniques. We do not use brute force barbaric straps that cause unnecessary tissue necrosis and crush injuries to the nerves. Claire's jaw tightened for a fraction of a second, a micro-expression of profound exhaustion that Aiden entirely missed. Sometimes precision instruments aren't fast enough for catastrophic arterial bleeds, doctor. A severe mechanism of injury doesn't always wait for a sterile field. Aiden let out a short, incredibly patronizing laugh. He stepped directly into Claire's personal space, towering over her. Listen to me very carefully. I have clamped severed femoral arteries with a mosquito hemostat in under 10 seconds in the dark. I do not need a piece of rough canvas to do my job. Throw this out and stick to the standard stocking list authorized by the board. I will not have my trauma bay looking like an army surplus store just because you watch too many war documentaries. Without breaking eye contact, Aiden dropped the tourniquet into the red plastic biohazard bin. He turned on his heel and walked out, immediately resuming his lecture to Dr. Hayes, as if Claire had already ceased to exist. Claire stood perfectly still until the doors swung shut. She didn't look angry. Her eyes simply grew incredibly distant, glossing over with a profound, heavy shadow. She walked over to the biohazard bin and stared down at the black strap resting on top of discarded gauze wrappers. For a fleeting, terrifying second, the sterile white walls of St. Vincent's vanished. The harsh, buzzing fluorescent lights were instantly replaced by the blinding, unforgiving, white-hot sun of the Helmand province in Afghanistan. The distant beeping of the IV pumps morphed into the deafening, chest-rattling roar of a medical evacuation, Black Hawk helicopters' rotors kicking up a storm of blinding grit. She didn't smell the hospital-grade bleach anymore. She smelled burning diesel, the metallic tang of cordite, and the heavy coppery stench of massive human blood loss. Before St. Vincent's, Claire had spent 4 grueling years as a forward surgical team FST trauma nurse. She had operated in blood-soaked canvas tents where the temperature frequently hit 110 degrees. In that world, the luxury of a sterile surgical field was a laughable fantasy. In that world, keeping a 19-year-old Marine alive after he stepped on an IED meant plunging your bare, unwashed hands directly into a smoking blast cavity to pinch off a severed artery against a shattered pelvis while the ground shook from secondary mortar fire. She knew exactly what a human body looked like when it was violently torn apart by kinetic energy, and she knew exactly how fast a young man could bleed dry. 3 minutes. That was the window. She reached into the biohazard bin and retrieved the black tourniquet. With slow, deliberate motions, she wiped the nylon strap down with an alcohol swab. She didn't throw it away. Instead, she quietly tucked the heavy strap deep into the oversized cargo pocket of her scrubs. She didn't say a word. She just went back to folding the sterile surgical drapes, her movements precise, economical, and heavily practiced. Over the next few weeks, the dynamic between them remained identical. Aiden commanded the room with his signature arrogant theatricality, barking orders, throwing instruments when frustrated, and belittling residents for minor infractions. Meanwhile, Claire stood in the periphery, a silent sentinel anticipating needs before they were even voiced by the surgical team. She always had the exact right suture, ready the suction, perfectly positioned. The massive transfusion protocols primed before Aiden even realized his patient's blood pressure was critically tanking. Aiden, in his blinding hubris, mistook her brilliant anticipation for basic expected competence. He had absolutely no idea he was working alongside someone who had seen more catastrophic human anatomy in a single weekend in Kandahar than he had encountered in his entire decade-long civilian medical career. To him, she was just the quiet one. But the quiet was about to break. And when it did, the pristine walls of Dr. Aiden Kensington's world were going to shatter. It happened on a Friday night at 11:14 p.m. The harsh blaring alarm of the red emergency phone at the nurse's station shattered the relative calm of the ER. Brenda Carmichael, the veteran charge nurse, grabbed the receiver. Within seconds, all the color drained from her face. "Listen up!" Brenda shouted, slamming the phone down. The entire floor froze. "Mass casualty incoming. We have an industrial explosion at the old O'Malley steel fabrication plant on the edge of town. A pressurized chemical vat ruptured. Shrapnel blast waves, secondary collapses. EMTs are bringing in the first wave now. They're calling a code triage. I need every available surgeon on the floor." The doors of the ambulance bay burst open violently before anyone could fully process the warning. A gurney came flying through the entrance, pushed by two frantic paramedics soaked in dark arterial blood. On the gurney was Caleb Jensen, a 32-year-old steelworker. He was thrashing weakly, his skin pale as ash, his work clothes shredded into blackened smoking rags. "Talk to me!" Dr. Kensington yelled, sprinting out of the break room, snapping on a pair of sterile gloves as he ran. 32-year-old male caught in the primary blast radius, the paramedic shouted breathless as they shoved the gurney into Trauma Bay 1. Impaled by a jagged piece of steel piping in the right lower quadrant, severe shrapnel lacerations. BP is tanking 70/40. Heart rate is 140. We couldn't get a secure line in the rig. He's hypovolemic. Claire was already in the room. She had the massive transfusion protocol, MTP, initiated before the gurney even locked into place. She slammed 2 large-bore IVs into Caleb's surprisingly flat veins with a ruthless single-motion precision that would have stunned Aiden had he been paying attention to her. "All right on my count transfer," Aiden commanded. 1, 2, 3. They shifted Caleb onto the trauma bed. The extent of the damage was horrifying. A thick, rusted piece of steel was lodged deep into his groin and lower pelvis, acting as a plug for a massive unseen wound. The surrounding tissue wasn't just cut. It was violently hollowed out by the kinetic force of the blast, a classic cavitation cavity. "Let's get this pipe out and find the bleeder," Aiden barked, holding out his hand. "Scalpel, clamps, lots of them." Claire froze her hand, hovering over the tray. Her eyes locked onto the wound. The bruising radiating outward from the steel pipe was a deep mottled purple spreading too fast. The skin was taut shiny. "Doctor," Claire said, her voice surprisingly loud, cutting through the chaos. "You can't pull that out, not yet." Aiden glared at her, his eyes blazing above his surgical mask. "Excuse me, it's a blast injury," Claire said, stepping forward, pointing a gloved finger near Caleb's hip. The kinetic energy from the explosion creates a temporary cavity. The internal damage is a massive sphere around the entry point. The pipe is the only thing tamponading the femoral and iliac arteries. If you pull it now without gaining proximal control in the abdomen, He will bleed out on this table in less than 60 seconds. The room went dead silent, save for the frantic, erratic beeping of the heart monitor. The junior resident stared at Claire in shock. Nurses didn't contradict Dr. Kensington. They certainly didn't lecture him on physics and blast ballistics. "Nurse Dempsey," Aiden growled, his voice vibrating with lethal condescension. "I am a board-certified trauma surgeon. This is a penetrating trauma. I am going to pull the foreign object, clamp the lacerated vessel, and tie it off. Just like I have done 1,000 times. Do not ever interrupt my clinical judgment again. Now hand me the clamps." "He doesn't have the blood volume for you to go digging," Claire pleaded, abandoning her usual deference. "Look at the bruising he's hemorrhaging into his retroperitoneal space. The artery is likely shredded, not sliced. You won't find a clean edge to clamp. We need to do a reboa, or pack the wound first." "I said clamps," Aiden roared. Reluctantly, a terrified junior resident slapped a heavy set of hemostatic clamps into Aiden's palm. Aiden took a breath, gripped the rusted steel pipe protruding from the worker's pelvis, and pulled. The pipe slid out with a sickening wet suction sound. For a fraction of a second, nothing happened. Aiden shot Claire a triumphant, arrogant glare. "See, now we just find the—" He didn't finish the sentence. Without the steel pipe compressing the severed, shredded arteries deep within the pelvic bowl, the pressurized blood found an exit. A geyser of dark crimson blood erupted from the wound, with the force of a fire hose hitting Aiden squarely in the chest and splashing up into his face shield. "Jesus Christ!" Aiden screamed, stumbling backward, temporarily blinded by the blood. The monitor shifted from a fast, frantic beep to a terrifying, drawn-out drone. Caleb's blood pressure plummeted instantly, 40 over palp. He was crashing. Aiden lunged forward, plunging his hands into the gaping wound, desperately clicking clamps blindly into the pool of blood. "Suction. Give me suction. I can't see anything. Where is the artery? I can't find it." "It retracted into the pelvis," Claire yelled over the din. "You're clamping blindly. You're going to crush the nerve plexus." "Shut up and give me more sponges." Aiden panicked, his usually steady hands visibly shaking. He shoved a handful of gauze into the hole, but the blood simply pushed it back out, overflowing onto the floor in a horrifying cascade. The patient was exsanguinating. Pints of blood were leaving his body by the second. Aiden stood there, his hands submerged, and the patient utterly paralyzed by the catastrophic failure of his textbook civilian protocols. He looked up, his eyes wide with genuine, unadulterated terror. He was watching a man die, and he had absolutely no idea how to stop it. I can't stop it," Aiden whispered, the arrogance completely stripped from his voice. "He's bleeding out." Claire Dempsey didn't ask for permission. "Move." The word wasn't a request. It was a ballistic impact. Before Dr. Aiden Kensington could process the command, 2 hands clamped onto his shoulders with shocking strength and physically violently shoved him backward. His expensive leather clogs slipped on the blood-slicked floor, and he crashed into a stainless steel instrument tray, sending a cascade of useless clamps and scalpels clattering against the tiles. Claire Dempsey didn't even watch him fall. She was already moving, transforming in the blink of an eye from the invisible, quiet wallflower of St. Vincent's into a battlefield commander. The hesitation and deference were gone, replaced by a terrifying, cold-blooded hyper-focus. "Brenda!" Claire roared, her voice dropping an octave, carrying the distinct, unmistakable crack of military authority. "Get on that radio. Tell the blood bank to send every unit of O negative they have right now. I want the rapid infuser primed and running wide open. Do it. Brenda Carmichael, a veteran nurse of 20 years, didn't question the sudden shift in the chain of command. She scrambled for the phone. Caleb Jensen's eyes rolled back. His heart monitor screamed a continuous, unbroken tone. A systole. He was arresting from sheer volume loss. Claire didn't reach for the defibrillator. You can't shock an empty heart. Instead, she did something that made the junior residents gasp in absolute horror. She climbed directly onto the trauma bed, straddling Caleb's left leg. "You're going to kill him!" screamed Dr. Colin Bradley, a first-year resident paralyzed by the sheer volume of blood pooling on the mattress. "He's already dead if we don't stop the leak," Claire fired back. With brutal, calculated force, Claire drove her right knee directly into Caleb's abdomen, positioning her kneecap just above his umbilicus. She dropped her entire body weight onto that single point, driving her knee deep into his soft tissue, pressing down until she felt the hard, unyielding ridge of his lumbar spine. She was performing a desperate, aggressive manual compression of the descending aorta. It was a massive gamble, a brutal blunt force maneuver taught in forward surgical tents and combat zones when a junctional bleed couldn't be reached. By pinning the body's main arterial highway against the spine, she was effectively cutting off the blood supply to the entire lower half of his body, starving his legs to keep his brain and heart alive. Instantly, the geyser of arterial blood erupting from Caleb's pelvis slowed to a sluggish, dark seep. "It worked," Colin whispered, his face the color of chalk. "It buys us exactly 4 minutes before his organs start dying of ischemia." Claire snapped, not letting up the bone-crushing pressure. "Dr. Bradley, in the second drawer of my crash cart, there is a black tourniquet. Grab it. In the third drawer, there are 3 packages of quick clot combat gauze. And get me a 24 French Foley catheter with a 30 cubic centimeter balloon." Now, Aiden was finally pulling himself up from the floor, his scrubs soaked in Caleb's blood, his face pale. He watched in stunned, humiliating silence as his trauma bay was hijacked by a nurse. He opened his mouth to shout, to assert his dominance, but the words died in his throat. He had no solution. He had failed. "Foley catheter!" Aiden stammered, gripping the edge of the counter. "What are you doing? He doesn't need a urinary catheter. It's not for his bladder." "Doctor," Claire said, her eyes locked onto the jagged, cavernous wound in Caleb's groin. "Bradley, hand me the Foley." The trembling resident ripped open the sterile packaging and handed her the thick silicone tube. Still keeping her body weight pinned on Caleb's abdomen with her knee, Claire took the catheter and fed the tip directly into the gaping blast wound, sliding it deep into the shredded tissue cavity toward the severed iliac artery. "Syringe," she barked. Brenda slapped a 30 cubic centimeter syringe filled with sterile saline into Claire's waiting hand. Claire attached it to the port of the Foley catheter and slammed the plunger down instantly, inflating the heavy silicone balloon deep inside the patient's ruined pelvis. "Pull traction," Claire ordered Brenda. Brenda grabbed the end of the catheter and pulled it taut. The inflated balloon inside the wound cavity lodged perfectly against the severed arterial stumps, acting as an internal high-pressure tamponade. It was a makeshift reboa, a brilliant improvised hack born from the desperate necessity of war. "Now the combat gauze," Claire demanded. She grabbed the chemically treated rolls of Quick Clot, designed to instantly coagulate blood on contact, and began mercilessly packing them into the wound cavity around the catheter, shoving the rough fabric deep into the traumatized tissue with her thumbs. "Hold pressure right here," Claire commanded the resident, grabbing Colin's hands and forcing them onto the packed wound. "Do not let up, or the clot breaks." Claire finally shifted her weight and stepped off the bed. She looked up at the monitor. The flat line had broken. A weak, reedy rhythm was establishing itself. Thump, thump, thump. "Blood pressure is coming up," Brenda announced, her voice shaking with adrenaline. 60 over 40, 70 over 50. The rapid infuser is catching up. We have a pulse, people. We have a pulse. The room exhaled a collective shuddering breath. The deafening chaos was replaced by the mechanical, rhythmic hum of the ventilators and the steady, life-saving beeping of the cardiac monitor. Claire stood at the foot of the bed, her scrub stained crimson up to her elbows. She took a slow, steadying breath, her posture returning to its usual rigid, unassuming stance. She turned her head and locked eyes with Aiden. The renowned chief of surgery was leaning heavily against the sink, looking small, fractured, and entirely obsolete. "Dr. Kensington," Claire said softly, the military bark gone from her voice, replaced by an eerie professional calm. "The hemorrhage is controlled. The patient is hemodynamically stable for transport. I suggest you page Dr. Aris in vascular surgery to meet you in operating room 4. He will need a synthetic graft to repair the iliac artery. You have the floor, doctor." Aiden swallowed hard. He looked from Claire to the miraculously stabilized patient and back to Claire. He slowly nodded. "Transport," Aiden croaked, his voice cracking. "Let's move him." As the team scrambled to push the heavy gurney down the hall toward the surgical suites, Claire stayed behind. She calmly walked over to the biohazard bin, picked up the discarded wrappers of her combat gauze, and began wiping the blood off the linoleum floor. Just like a ghost. 72 hours later, the sterile, sunlit offices of the hospital's executive floor felt like a different planet compared to the blood-soaked basement of the ER doctor Harrison Caldwell. The chief of medicine sat behind his massive mahogany desk, his fingers steepled in front of his face. At 65, Caldwell was a shrewd, imposing man who didn't tolerate insubordination, but he tolerated medical failure even less. Sitting rigidly in the leather chairs across from him were Dr. Aiden Kensington and Nurse Claire Dempsey. Aiden looked exhausted. He was wearing his signature tailored suit, but the usual arrogant strut was entirely absent. Beside him, Claire wore her standard slightly oversized scrubs, her hair in its severe bun staring blankly ahead. "I have reviewed the incident report from Friday night." Caldwell began, his deep voice vibrating through the quiet room. "I have also spoken to the trauma residents, the charge nurse, and Dr. Aris in vascular. Furthermore, I have reviewed the overhead security footage from Trauma Bay 1. Caldwell paused, fixing a hard stare on Aiden. "Aiden, you filed a formal grievance against Nurse Dempsey," Caldwell said, tapping a thick file folder on his desk. "Citing gross insubordination, reckless endangerment, and physical assault against a superior attending physician. You requested her immediate termination and the revocation of her nursing license." Claire didn't flinch. She simply blinked, accepting the impending destruction of her career with the same stoic detachment she applied to everything else. Aiden shifted uncomfortably in his chair. "Dr. Caldwell, the protocol in my trauma bay—" "Stop right there," Caldwell interrupted, raising a hand. He opened a second, thinner folder. Let's talk about protocol. The patient Caleb Jensen is currently awake and extubated in the ICU. He will keep his leg, and he will survive. Dr. Aris explicitly noted in his surgical report that the unorthodox but brilliantly executed Foley tamponade was the sole reason the patient did not bleed to death on the table. Caldwell leaned forward, his eyes narrowing. The footage shows you pulling a penetrating object from a highly pressurized blast wound without establishing proximal control, Aiden. A first-year medical student knows that is a lethal mistake. You panicked. You froze. You lost the patient. Aiden's face flushed a deep, humiliating red. He looked down at his hands, the celebrated golden hands that had completely failed him when it mattered most. The presentation was unusual. The presentation was a combat wound, Caldwell stated bluntly. He turned his attention to the quiet woman sitting next to Aiden. Which brings me to you, Ms. Dempsey. Or should I say, Major Dempsey. Aiden's head snapped up. Major, Caldwell opened the thin folder, revealing a stack of heavily redacted military documents. When this grievance crossed my desk, I had our HR department do a deeper background check. Your file was remarkably empty for someone with 15 years of nursing experience. That's because the bulk of your career is classified by the Department of Defense, Caldwell read from the paper. Claire Dempsey, Major United States Army Nurse Corps, served 4 tours in Afghanistan and 1 in Syria as the lead trauma nurse for the 75th Ranger Regiment's Forward Resuscitative Surgical Detachment. Awarded the Bronze Star and eventually the Silver Star for gallantry in action, specifically for keeping 3 critically wounded soldiers alive during an active mortar barrage after your lead surgeon was incapacitated. The silence in the office was deafening. Aiden stared at Claire as if she had suddenly grown a second head. The quiet, invisible woman he had belittled for weeks was a decorated military hero who had operated under literal enemy fire. I prefer to keep my military service out of my civilian practice, Dr. Caldwell, Claire said softly, her voice perfectly even. Civilian hospitals tend to frown upon battlefield improvisation. As Dr. Kensington pointed out, this is a civilized hospital. I crossed a professional line by making physical contact with an attending physician. I will pack my locker. You will do no such thing, Caldwell said sharply. He picked up Aiden's formal grievance and slowly, deliberately ripped it in half, tossing the pieces into his wastebasket. Major Dempsey, you saved a man's life when my chief of surgery completely abandoned his clinical senses, Caldwell said. You aren't being terminated. In fact, effective immediately, you are promoted to the position of lead clinical trauma educator. You are going to teach every resident and every attending in this hospital how to handle catastrophic blast trauma. Caldwell turned his steely gaze back to Aiden. As for you, Aiden, you have 2 choices. You can resign your position as chief of surgery today, and we can part ways quietly. Or you can withdraw your ego, stay on my staff, and spend the next 6 months shadowing Nurse Dempsey to learn how to actually manage a mass hemorrhage crisis, instead of just acting like you know how. Aiden sat frozen. For a decade, his identity had been built entirely on his infallibility. He was the smartest man in every room. But the memory of Friday night, the hot blood hitting his face, the blind panic, the absolute helplessness burned in his mind. He had looked death in the eye and blinked. Claire had stared it down and forced it into submission. Aiden looked at Claire. She wasn't looking at him with smugness or vindication. She just looked tired, She was a woman who had seen too much death, and she simply refused to let it take another life on her watch. Aiden took a deep breath, the arrogance finally permanently draining from his posture. "I'll stay," Aiden said, his voice barely a whisper. He turned to Claire, a genuine, humbling respect replacing his usual disdain. "If she is willing to teach me." Claire looked at the shattered surgeon. For the first time since she arrived at St. Vincent's, a faint, barely perceptible ghost of a smile touched the corner of her lips. "We start with the crash cart, Doctor," Claire said quietly. "And you owe me a new combat tourniquet." Did Nurse Claire Dempsey's split-second rule-breaking decision leave you breathless? In the chaotic world of trauma medicine, true heroes don't always wear the title of chief surgeon. Sometimes they're the quiet veterans standing in the shadows. If you loved seeing how Claire used her battlefield expertise to pull a patient back from the brink of death and put an arrogant doctor in his place, hit that like button, share this incredible story, and subscribe to our channel for more amazing real-life medical dramas.